Next up, we're going to teach a muscle energy technique or joint mobilization for the first rib, and we're going to do this in sitting, and I'll show you from both sides. The first way to assess the first rib is through a motion, and typically in the clinic I'd like to palpate from the back, but since it's so easy to reach behind your neck and palpate it yourself, I think you can do it pretty well on your own. So the first thing to remember is, at the line of your neck, which would be directly underneath the lateral aspect of C2, is where your first rib is. So you can just reach behind just at the base of your neck. So here's the base of my neck, right? I'm going to go right there and right behind. And that first bone, which is sort of flat, that you'll feel is your first rib. So I'm cupping onto it with my fingers like that to apply a little pressure to palpate, and then we'll see how much motion I have. So the assessment would be to rotate as far as you can to the left, and after having mobilized C2, you should be able to have pretty good motion. So motion to the left, and then your neck would drop down, and we'll see how far that goes. You can see it's probably a little limited. It should go down a little further than that. On the right hand side, it will work as a comparison. Again, I've palpated my first rib. I rotated to the away, and now I'm going to side bend and flex down, and I presume that looks like I have more motion. I did check from a side angle earlier. But sometimes your patient will be limited both ways, but they might just have more discomfort, or you might palpate a firmer end feel at that point. All right, so the next thing you could do is just, again, I'm going to mobilize my right side. So again, right at the base of my spine, I'm going to wrap my middle finger, this one, right around the back onto my first rib, and hold it there, and I'm going to rotate to the right. Now you could use a tool if you're so lucky to have one. I like this one, a Theracane. I'm going to stick it inside my shirt here. So it's located in that same spot, and then you can rest your arms, all right? So I'm going to rotate to the left and sink down. Take a deep breath and relax. And I'm just going to maintain the force here with the Theracane. Take a deep breath and relax, and go into full flexion and side bending. With my finger, it would look like this. All right. You can see it looks like I have a little bit more motion now. I'm going to show you from the back. So, from the back, base of the neck, right? I'm going to take my middle finger and just palpate right there, right where it's, you'll see like a flat barrier. That's the first rib where it meets the cervical spine. Rotate away and side bend in. Contract, relax. If I was going to use a Theracane, it's the same thing. So there's my spot. I'm holding this. It's a posterior to anterior force. Take a deep breath and relax. And that's how it's done. And that's how it's done. All right.